Today's topic is vitamins A and D, and looking at this study that was published in 2008 in Nature Reviews Immunology called Vitamin Effects on the Immune System, Vitamins A and D take center stage. And I just want to point out the date that this was published, 2008, because it's now 2022, and in recent years during crises regarding the immune system, quote unquote experts on immunology and public health said that vitamins were useless and wouldn't be effective against viruses. But of course, anyone with a critical thinking brain probably figured out that that was not true. And so, I said all along that there's been piles and piles of research documenting the effectiveness of vitamins A and vitamin D as antivirals, along with many other functions. And here's one paper from over 10 years before the crisis that showed, hey, if we're sufficient, good things happen. And so I want to highlight that by jumping to this quote on the front page of the paper, okay? So there's a quote by a Nobel Prize winner in physiology named Albert Szent-Györgyi, I believe is how you'd pronounce it. And he says, quote, "A vitamin is a substance that makes you ill if you don't eat it." Right? So in other words, if you're deficient or insufficient in vitamins, then you might get sick for lack of the good thing that you require by nature. And below that, it says vitamins are organic compounds that are required in trace amounts in the diet because they cannot be synthesized in sufficient amounts by an organism. So for example, we can't make vitamin D, we need to take it in, right? Vitamins and their metabolites are essential for a large number of physiologic processes, including immunology. So if we jump up here to the abstract, vitamins are essential constituents of our diet that have long been known to influence the immune system. What? What blasphemy. In 2008, they've long been known to influence the immune system, but in 2020, they were quackery and useless. Anyways, vitamins A and D have been shown to have an unexpected and crucial effect on the immune response. That's useful against the virus. Essential roles of vitamins A and D function in modulating a broad range of immune processes, such as lymphocyte activation and proliferation, T helper cell differentiation, tissue-specific lymphocyte homing, the production of specific antibody types, and regulation of the immune response. We discussed the clinical potential of vitamin A and D metabolites for modulating tissue-specific immune responses and for preventing and or treating inflammation and autoimmunity. So again, if you spoke to a doctor or watched a talking head on the news in the last couple of years who said nutrition was useless and vitamins were useless, then really that person's useless. So this paper is 28 pages. You can dig in. It's available for free actually online. If you just search the title, you can get it. But I want to dive down into the graphics at the end because I think we can learn from the pictures sufficiently enough. So in regards to vitamin D, it's common knowledge that vitamin D is key in calcium metabolism and bone health. The average person, the lay person understands vitamin D that way. It's, if I don't have enough vitamin D, then I'll have osteoporosis is kind of the thinking. But vitamin D is important for many more things beyond bone health. It's important for the immune system, as we'll talk about today, and including antiviral response. It's important for gut barrier, blood-brain barrier, any barrier system. It's important in skin issues like skin infection, psoriasis, eczema, different things like that. It's important in dopamine signaling, so your mood and your motivation and your enjoyment of anything. It functions in a broad array of physiologic processes. So this picture here is showing specifically how vitamin D influences different cells in the immune system. And you can see that monocytes and macrophages, it increases their proliferation, which means it increases their ability to increase in numbers. So if we have a viral infection, we want to proliferate the monocytes and macrophages because they are the innate immune response's way of killing infection. That's one way vitamin D contributes to infection clearance. The next is right underneath that. You can see it increases cathelicidin. Cathelicidin is what's called an antimicrobial peptide. And it's all in the name there. It's antimicrobial. So if it's a bacterium, it would be antibacterial. If it's a virus, it'd be antiviral, antifungal, whatever you want to, whatever you're facing there. Cathelicidin is going to help at the gut barrier, in this case, to clear those microbes. In dendritic cells, dendritic cells are the main cells that present foreign substances to the adaptive immune system so that the adaptive immune system can decide, is this self or not self? So is this Jennifer or not Jennifer? Is this Tim or not Tim? Is this Sue or not Sue? Is this John or not John? Whoever the individual is, the immune system has to be able to know the difference between self and not self. If it gets blurry on that discernment, then autoimmunity can occur. So if we have less dendritic cells available to present self tissue, then we have a lower risk of autoimmune disease. And so vitamin D helps. One way it helps prevent autoimmune disease is by decreasing dendritic cell maturation. As far as adaptive immune system response, vitamin D impacts T cells and their ability to clear and kill infection. And it has an overall suppressive effect on them so that they don't go too robustly, right? So we don't have increased risk of autoimmunity if they're not resolved sufficiently. And we've talked in previous videos about inflammation, and that inflammation inherently is not bad. It's when inflammation is too robust for too long or isn't resolved properly, that's when bad things can happen. Vitamin D helps with inflammation resolution via TR1 responses, which TR1s are a form of T regulatory cells, which help quiet the immune response in a potentially overactive inflammatory response. And then from an antibody perspective, vitamin D decreases antibody production, which again, in an autoimmune context, if you're creating antibodies towards self-tissue, vitamin D is helping dampen that antibody production, so that would help dampen self-attack. So, you know, we could talk for an entire session on just this picture, but this picture is sufficient enough to, you know, discredit anyone who says that vitamin D doesn't have an immune response or an antiviral response. The next picture here brings in vitamin D, vitamin A. Oh no, I'm sorry, this one's just vitamin A. So yeah, let's focus on vitamin A first. So vitamin A plays many roles just like vitamin D. Vitamin D is anti-inflammatory. Vitamin A is anti-inflammatory, antiviral, functions in vision, functions in thyroid, functions in mucosal barrier, so gut lining, lung lining, blood-brain barrier lining. Vitamin A is important in genetic expression of many things, or of many genes. So we need vitamin A. And again, as we said at the start, if you don't consume enough of a vitamin, you can be sick because of it, right? So it's a key necessary nutritional input. Well, this picture shows us that vitamin A has a big impact on what's called the adaptive immune system. The adaptive immune system is made up of our T cells and our B cells. T cells you can think of as the main assassins or the highly trained SWAT team killers. B cells are what ultimately result in antibody production. Okay, so from a T cell perspective, vitamin A, the active form is called retinoic acid. So these purple boxes that say retinoic acid, that's vitamin A. Okay, so vitamin A helps promote FOXP3 T cells, T regulatory cells, which T regulatory cells are the cells of the immune system that quiet inflammation. Shh, quiet down. Don't be too inflamed. Or, hey, we had the inflammatory response we needed to kill the virus. Now we want to resolve it and put it out because we don't need to stay inflamed. We've cleared the virus at this point, okay? Vitamin A inhibits production of Th17 cells. Th17 cells, when inappropriate, are the cells that drive the tissue damage seen in autoimmunity. So if you're lacking vitamin A, you have a higher risk of naive T cells, which are immature babies, developing into autoimmune promoting Th17 cells if the right or wrong, depending on how you're looking at it, environment of cytokines or immune chemicals is there. So vitamin A helps prevent autoimmunity in that way. Vitamin A also impacts the what's called gut homing of T cells. So here's where vitamin D and vitamin A are going to be opposites. Everybody needs a home, right? If you're watching this, you have a home, hopefully. And so we all have a home to return to. We go to work, we return home. We go out with friends, we return home. Well, in the same way, immune cells can home to different locations. And vitamin A causes gut cells to, or excuse me, T cells to home to the gut, to return to the gut. Okay, so we have immune cells, they may travel throughout the body. You may have an infection in the lungs, say. They may travel to the lungs and help clear that infection. And then when there's sufficient vitamin A around, it will cause those cells to home back to the gut. Don't stay out too long, so to speak, okay? And so that's one role of vitamin A from a T cell perspective. Vitamin A from a B cell perspective promotes production of IgA, okay? So you can see immunoglobulin A here and here. And immunoglobulin A is the first line of defense at our mucosal barriers. You can see the gut, the GALT here is gut-associated lymphoid tissue, and the MALT is the mucus is the, excuse me, mucosal-associated lymphoid tissue. And so wherever we have mucus, gut, lung, sinus, bladder, we have IgA in the mucus, and that's the first line of defense to grab the pollen or grab the gluten or grab the bacterium that entered our sinuses or entered our gut that shouldn't be there. The IgA grabs it and complexes with it and just goes out the chute and is excreted through the GI tract or through the nasopharynx or whatever we're talking about. So vitamin A helps produce those antibodies which form the first line of defense at barrier systems. Okay, so A is very important there. And then this picture helps us see, let me make sure I'm looking at the right thing. Yep, so this picture up here at the top helps us see vitamin A and vitamin D and some of their opposing functions. So we talked about vitamin A here, retinoic acid, driving or causing cells to home to the gut or home to the small intestine. Well, vitamin D causes cells to home to the skin. Okay, so why would this, and they reciprocally inhibit each other, as you can see here. So vitamin A would cause cells to home to the gut, not the skin. Vitamin D would cause cells to home to the skin, not the gut. Why might this matter clinically? Well, say you have a skin infection and say you have low vitamin D, but you have sufficient vitamin A. Well, let's draw this because it'll help the point land better. So if you have a teeter-totter or a seesaw, right, and you have it looking like this, and you have vitamin D that's too low, and you have A that is either sufficient or too high, well, then you've got a relative bias toward A, right? So then in your skin infection, A would be more predominant, so A would be causing more cells to home to the GI tract, except you need those cells homing to the skin because you need to respond to that skin infection. So potentially your skin infection lasts longer and maybe gets a stronger hold in your case because of your D deficiency primarily, but then also, you know, related is the A sufficiency, which is going to direct more cells to the gut. So less get to the site where you need them. And you could do the opposite. You could say vice versa. What if you have a gut infection and you have sufficient D, but you have low levels of A? Okay. Well, now potentially cells are being pulled away from the gut and doing more skin duties than they should be, or relative to what we want going on in the gut. So, you know, vitamin D and vitamin A both being sufficient allows that dance to be more nuanced and more successful. So the take home here is that clinically it's relevant because A, we don't want to have deficient D or A, period. Like the study started, we need all vitamins. We don't want deficiencies because that leads to illness. But then more specifically, if we have virus issues, we need them both sufficient. If we have skin issues and or gut issues, then we want them balanced, because an imbalance in one versus the other may be moving immune cells in a disadvantageous way from what we want clinically. So we need sufficient levels of D and of A. And how do you know what your levels are? You can test those levels through LabCorp. You can run a 25 hydroxy vitamin D and a 125 dihydroxy vitamin D to see your vitamin D ratios and how you're doing there. You can run a vitamin A test in the blood and see your vitamin A level. And then that allows you to be more specific with, do you need to supplement and how much? And it allows you to titrate your dosing. And then it allows you to, you know, if you have symptoms and say skin issues versus gut issues, it allows you to understand perhaps why those are persistent if you have a deficiency going on in one of these. So I hope this was enlightening and interesting and helps you understand that nutrition always matters regardless of what's going on in your health, whether it's a worldwide viral crisis, so to speak, or you've got autoimmunity, or you've got vision issues. Okay, we need all vitamins, and we need them at sufficient levels, or else you'll be ill, as the Nobel Prize winner said. So let's open this up.
How often would you say to check some, like your levels? Yearly, just when you're sick? You know, like not, I mean, what's a...
You know, and kind of how I do it with my patients is the best way I can answer it, I guess, is if someone's presenting acutely, right, or presenting to my office for the first time, not necessarily acutely, but for the first time, if they're presenting to my office, they've got issues, because why would they come if they didn't, you know,
right,
or they at least have symptoms. Right. So then we test them. And I want to know those levels from the start, because again, if they're lacking, we can get sexy with all the stuff we want to do. But if we leave A or D or both deficiency, then we're in trouble. So we establish your baseline number. And if they're good, right, then cool. We'll just follow up while we're in the active plan of care with you. So like Elizabeth, your D was fine, right? You were in the 60s when we first met. So I don't need to follow that as often, right? So we're not going to test it at the midterm, but at the 3 months, we'll test it again just to see where are you at, okay?
Right.
And say at the midterm, you're all good, we're high-fiving, you're spreading your wings, see you later. Well, then I usually say, okay, let's set an alert for, say, 6 months or 12 months out just to do your yearly physical, but actually this one gives you real information that you can use.
Right.
And at that time, we would be looking at things like this that matter, just to make sure, hey, in the last 6 months to a year, things haven't dipped. Because remember, these are all, your physiology is dynamic. So you could have a great vitamin D when you first present, and then you have a virus that lowers your vitamin D because you're using D to help combat the virus, right? Or you become inflamed for whatever reason. So say someone like Jennifer, when Jennifer started, Jennifer was, you
A
know,
hot mess.
yeah, she was a little heavier than she was right now, than she is right now.
A little.
Right. So just the fact that you have more adipose tissue or fat tissue, adipose tissue is an endocrine organ. It's an inflammatory unit itself, right? So the heavier you are, that inflammation factory keeps spinning it out. Well, we have to use our fire extinguishers constantly, right? The heavier we are. So your D isn't a dose for her. If I give you a D dose, that same dose for her, if she's heavier, probably isn't going to keep her where it'll keep you because she's using more. Make sense?
Yeah.
So in the interval between the last time we tested and the next time we test, you know, it's not enough to never test again once we got it there, because we're never set there, because life and physiology are going to happen.
Okay.
Right. So we seek in the active phase of care, can we get you there if you're not there yet? And then what's the maintenance dose to keep you there, given, say, a fairly consistent life, right? But of course, life happens and exposures and all these things happen that we can't necessarily control. So we want to check in periodically to just make sure that things haven't drained you too much.
Got ya. Okay, thanks.
Yep. The last piece to that would be, because once we get your maintenance dose, so you're taking that, but if you now have an infection, that's not enough for the infection.
Okay.
Right? The maintenance dose was to keep you at baseline, assuming you're staying good. But now you layer on an infection and a greater demand, so supply needs to be higher, right? So it's kind of like, what are your vitamin D economics?